Welcome to the Dr. Tom Show News Edition, where I will bring you news from the world of dentistry, starting with the October 2025 issue of Dentistry Today. The first article written by Joanne Jones, a hygienist that's also an accomplished speaker and thought leader. In this article, she shares two very different stories of dental patients with oral cancer. The first, a 22-year-old woman who initially mentions a bluish-black raised area on her hard palate that was dismissed by the dental team as nothing to worry about. When she was in the dental chair again over 3 years later, the dentist asked her about the black bump on her palate. She became very concerned and went to the emergency room and subsequently endured multiple surgeries and a long period of healing to treat this cancer. In the second case, a 34-year-old male had a biopsy of his palate in an area that he described to the dentist as having a funny feeling. It was diagnosed as a benign salivary gland tumor. However, the following year, his dentist observed that the area had changed in both size and texture, so the patient was referred for further treatment. His surgeon performed an excisional biopsy of the entire lesion, and the diagnosis was a low-grade mucoepidermoid carcinoma. Thankfully, it was caught early. The author ties these cases together with a brief discussion of how devices like the Velscope can significantly aid in the visualization of lesions that may appear harmless at first to the naked eye. The second article is written by Dr. Edward Kusek on the topic of laser bacterial reduction. Dr. Kusek's case reports make a strong argument as he used salivary testing with oral DNA to track his results. The patients considered for this treatment had the following in common: pocket depths of 5 millimeters or less, generalized inflammation, and bleeding on probing. The treatment is performed with an uninitiated tip on the diode laser at a very low energy, spending no more than 10 to 15 seconds per tooth. In the October issue, Dr. Nicole Watson shared an article titled Beyond Single Tooth Dentistry, a Systematic Approach to Full Mouth Rehabilitation. This article is presented under the banner of Coice Center Case. The patient in this case is a 58-year-old female dental hygienist that had received single-tooth dentistry over many years. However, due to her occlusal scheme, a lot of that dentistry was starting to fail. The detailed Coice workup evaluated the following: periodontal, biomechanical, functional, and dentofacial aspects to develop a comprehensive treatment plan. The case started with a deprogrammer to facilitate opening the vertical dimension of occlusion, and the case was spread out over 8 phases that took a total of 18 months. This was done in part to mitigate the financial burden on the patient. Congratulations, Dr. Watson. It was a beautifully done case. You can all check it out in the October issue of Compendium. And finally, we move on to Dental Economics. The October issue had an eye-catching title, Us versus Them, the Power Struggle in the Op. The editorial on page 10 was titled The Dentist-Hygienist Divide. It was written by a hygienist, Melissa Obrochta. She provides a thoughtful analysis on this topic, sharing her perspectives from both sides. Hygienists, on one hand, are faced with burnout and frustration that focuses generally around their schedules and can significantly hinder their ability to provide. Dentists, on the other hand, are under tremendous economic pressure trying to serve patients in an environment of shrinking reimbursements, plan restrictions, and rising costs. The author provided these suggestions. With proper focus, the hygiene department can become a profit center. Getting better team alignment in the office will not only improve the mood, but will get the whole team working towards common goals. And finally, dentists and hygienists would both benefit from some self-reflection to reorient their priorities, serve patients with a focus on quality care. Well, that's the news for this week. If you have a story to share or a question that needs to be answered, please contact me through my show website, at drtom.show. That's drtom.show. Thanks again. We'll see you next week.